Welcome to For the Good of Man podcast, where we bring real conversations about men's health issues straight from the experts. I'm your host, Ashton, and today we're diving deep into a topic that's often overlooked but plays a major role in male fertility and overall health: semen quality. Joining us for this special Q&A episode is Dr. Joshua Gonzalez, a board-certified urologist and expert in men's sexual medicine. In this episode, Dr. Gonzalez answers patient questions about what impacts semen health, from lifestyle and hormones to environmental factors and medical conditions. Whether you're planning for fertility or simply curious about what semen quality says about your health, this episode has practical insights you can use to take charge of your reproductive wellness. Let's get into it.
Start off with question number one. Can prolonged sex increase the semen volume?
So I'm assuming this person's asking about sort of like edging techniques, making like sort of delaying your time to ejaculation. There's not really any data that we can look at that says it definitely increases your volume. I think it's more important. A better marker would be abstinence between ejaculations. However, when some patients practice edging or delaying ejaculation, it can cause more vigorous contractions of your pelvic floor, which can lead to greater expulsion of fluid. So I'm not sure that it would be a clinically significant difference, but it certainly can intensify orgasm for some people.
Certainly. Okay, next question here. At my age, which is 71, is it hard to have an ejaculation? I am having a hard time.
Yes, so as I mentioned, age is probably one of the biggest predictors of decrease in ejaculatory volume. But another thing that we see that's very common as men get older is difficulty even getting to the point of ejaculation. So that's a different condition called delayed ejaculation, which is something that we know increases in prevalence over time or as men get older. There can be a number of reasons that happens. It can sometimes indicate a hormonal issue. It can indicate weakness in the pelvic floor, dysfunction of the pelvic floor muscles. So it can sometimes indicate undiagnosed neurological disorders, things like diabetes. So it's definitely something worth discussing with a provider. It is very common, but sometimes there are things that we can do to help.
All righty. Next question here. How can I have a stronger, more powerful ejaculation?
Good question. I would say, abstaining longer between ejaculations will often make the volume more, which can lead to more powerful orgasms. So that's number one. Number two, trying to prolong the sexual experience, similar to what the first questioner asked. Making sex last a little bit longer can make for a stronger contraction so that you expel more fluid. That can intensify orgasms. Sometimes I'll have patients practice Kegel exercises if I think that there may be some weakness of their pelvic floor. That can intensify orgasms and make them more powerful. And then, of course, taking a supplement like Popstar, which is going to increase your volume. With increased volume, you have to generate larger contractions, which can often cause the orgasm to last longer and be more intense.
For sure. Alrighty. Next question here. Is semen able to recover after prostate cancer treatment? Looks like he went through radiation as well.
Yes. So I think it would depend on the prostate cancer treatment and what was involved. So the two primary modalities that we have for prostate cancer are surgery, which typically will remove the prostate and seminal vesicles. So in those men, no, there is not a chance at recovery of semen volume because you're essentially removing the organs that produce 95% of the fluid. So men who have had a prostatectomy or cystectomy, which is removal of the bladder for bladder cancer, they will have what's called a dry orgasm, where they still have the contractions, they still have the cerebral pleasurable experience of orgasm, but they just don't produce fluid. Men who undergo radiation, the radiation itself doesn't always cause problems with ejaculation or reduce ejaculatory volume, but radiation is sometimes combined with androgen blockade, where we give men an injection of a medication that suppresses their testosterone for months to sometimes years at a time. And that can definitely have a detrimental effect on ejaculatory volume. In those cases, if men have received those treatments, if their testosterone over time starts to kind of come back, then sometimes you will see a sort of return of what your normal ejaculatory volume would be. We've had patients in that second category, patients who've had radiation, sometimes with androgen blockade, or even patients with age-related decreases in ejaculatory volume, take PopStar and report some improvement. So I would say if you're still kind of in that waiting period, it certainly wouldn't hurt to try a supplement like PopStar.
Alrighty. Next question here. How does CoQ10 and ashwagandha help to increase semen volume and sperm count?
So there's not any data that I'm aware of that actually show that those two ingredients really make a difference in terms of volume. They are CoQ10 is a antioxidant, so it is good, and typically we think of it as supporting sperm health, but not necessarily affecting volume specifically, like the total amount that comes out. Ashwagandha is another ingredient that is commonly used by people trying to kind of promote overall male sexual health, but the data are weak on how it affects really any male sexual health parameters. But as far as I know, I don't think there's any like reason good data showing that it improves volume. I certainly don't think it would hurt, but there's just not any data to support that it will make a big difference.
Alrighty. Next question here. How important is volume at my age of 68, and how can I increase it?
So I don't think volume is, necessarily an important marker of anything at someone's, for someone in their late 60s. I would say volume, especially if you're not trying to actively get pregnant, right? Like that's really where it becomes like a quote unquote medical issue. But that doesn't mean it's not important for your sexual pleasure, right? And that's kind of what we've been talking about all night tonight. I think we hit on some of the ways to improve it, both naturally from a medication standpoint, and then, of course, with supplements like PopStar. So I think those are some places that you could start. Does it inherently mean that you're like an unhealthy, unfit person? Absolutely not, because there are plenty of healthy men who have a natural decline in their semen volume. But I would say if it's something that bothers you, if you feel like sex used to be more pleasurable when you did ejaculate more, then try one of the top solutions that we talked about earlier.
Definitely. Alrighty. Another one right here. 63-year-old with very low ejaculation is around 2 milliliters normal. I think this is a little bit of a review, but great question nonetheless.
Mm-hmm. Yes, so you're definitely within that normal range. So there's not like an age, specific cutoff that we would say. So you're definitely within that WHO normal range. That doesn't mean that it's normal or ideal for you, right? If you used to be 5 mLs and now it's 2, that certainly can have a negative impact on, things like confidence and pleasure. So, I would say if it's something that bothers you, then, try a supplement like PopStar, maybe have a conversation with your healthcare provider to do some hormone testing or see if there's anything medically that can be done to kind of improve your volume. And then, some of the behavioral stuff that we talked about, making sure that you're sleeping 7-8 hours a day, making sure you're avoiding toxins, like alcohol and tobacco, exercising regularly, staying well hydrated. Those are some lifestyle things you could try as well.
Definitely. Alrighty. Next question here is a bit of a repeater, but I think we can maybe shift it. So the question is, does age affect semen quality and our quantity? And we know it does, so maybe you can talk about when that starts to shift.
Yeah, so I guess one thing to keep in mind is that what we are seeing globally is a decline in a variety of metrics for men's sexual and reproductive health. So your father's testosterone levels, your father's semen parameters were significantly better than what we're seeing in men today. The decline in semen quality starts probably in the 30s, right? And this all makes sense if you think of us as sort of products of evolution, right? Our bodies were not really meant to live past reproductive age. That's what our bodies are sort of designed for. And so this happens to all bodies, male, female, right? Our gonads, our testicles, our ovaries start to their function starts to deteriorate. And as a result of that, we get poorer quality sperm, less ejaculatory volume, declines in testosterone. And those processes start fairly early, like in your mid 30s. So certainly by the time you get into your 50s and 60s, your sperm quality is going to be much worse than it would have been when you were younger.
Alrighty, perfect. Let's see. Next question here. A little different, but at what age does semen stop being produced?
At no age. So you're always producing semen. As I mentioned, there are certainly things that can affect it and lower the amount that you are that you're seeing come out, but the production is always there. So there's not like you don't get to be of a certain age and just stop producing it altogether. It can become increasingly difficult to achieve ejaculation. It can become lower and lower volumes for a number of the reasons that we talked about, but it's not like you stop producing it at a certain age.
Alrighty. Next question here. Comments on anorgasmia post 90% removal of non-cancerous prostate. Should oxytocin be used right before sex?
I would probably have to know more about this specific situation. Oxytocin is typically a treatment that we use off-label for patients with ejaculatory and orgasmic dysfunction. Um, you know, this is something that we see after prostate cancer treatment. I don't know specifically what kind of treatment this person had. Anorgasmia typically refers to a lack, it literally means no orgasm or lack of orgasm. Remember that orgasm is different from ejaculation, even though in men they're often coupled and happen together. So I would want to understand more about what's happening with this particular individual. Is it that they are ejaculating and just no pleasure is associated with that ejaculation, or are they not producing any fluid, or both? So before we consider various treatments, we kind of have to get to the bottom of all of those things.
Alrighty, perfect. So that was the pre-submitted question list. Now we're on to some questions that were submitted in the chat live. So thank you for submitting those. Is androgel helpful in producing semen?
No. And this is something that is interesting because sometimes low testosterone in younger men can be a reason that volume is lower. And so we sometimes will put them on medications that I talked about earlier, clomiphene and clomiphene HCG, which kind of revs up the function of the testicle and results in better sperm, higher testosterone levels, and that sometimes will translate to larger ejaculatory volumes. Ironically, sometimes testosterone replacement therapy can cause lower ejaculatory volume because what it is doing is suppressing your natural production, your natural testicular function, and that can sometimes result in low sperm counts, poorer quality sperm, and decreased ejaculatory volume. So both low testosterone can cause decreased ejaculatory volume, and also testosterone replacement therapy can cause it.
Perfect. Alrighty. Next question here. I had a prostatectomy a year ago, and I would like to confirm that I do not produce semen or sperm anymore. Correct?
So if you have testicles, you still produce sperm. But if you had a prostatectomy, then they most certainly removed your prostate and seminal vesicles, in which case you do not make semen. So I think there's like an important distinction there. The sperm are produced in the testicles, as we talked about at the beginning. The semen volume, 95% of it is produced in the seminal vesicles and in the prostate. So the only two components of semen that you're still producing are the sperm and the testicles, but they have kind of nowhere to go because the vas deferens gets cut high in the pelvis as part of that surgery, and the bulbourethral glands that produce a small amount of lubricating fluid. That would be the only components that are still being manufactured. But when someone orgasms post prostatectomy, they do not make ejaculatory volume anymore.
Alrighty. Next questions here. We got a couple about Popstar. So any drug interaction concerns with Popstar, especially for heart patients on blood pressure or cholesterol meds?
So the short answer is no. Of course, anytime you're starting a supplement, you should definitely run it by your primary care provider, or anyone who is prescribing other medications to check that there are no interactions. But these are all natural ingredients: zinc, L-arginine, pygeum, lecithin, bromelain, fructose. So there are really not any interactions that I'm aware of when you're talking about hypertensive medications, and cardiac medications, and such. But we always encourage patients that if they're on other medications to run this supplement by their prescribing provider.
Certainly. Alrighty. Next question here. How long does it take Popstar to work?
It's a good question. So one of the things that we get emailed about a lot is, hey, I took it for a few days, didn't notice a difference. It's not working for me. We generally tell patients that they should try it for a minimum of 2 weeks, every single day. It's a daily supplement, so it's not like you can really take this like on demand when you want to have sex. And we always make sure that they're taking it with the right amount of fluid, or excuse me, right amount of water. So that's 16 ounces with 4 capsules every single day. If you take it for 2 weeks and aren't noticing anything, I would give it the full month. Each bottle is a 30-day supply. Take it for the full 30 days. If you don't notice a significant change, you can email Popstar and we have a money back guarantee. But it's not something that you can take for a few days and certainly notice a difference. Now, we do have patients that will report a difference within several days. So it can happen. I have some friends that do take it more on demand. They'll take it like starting on Thursday if they're planning to have a big weekend. But that's not really how it's meant to be taken. That's not how it's most effective. So daily 4 capsules with 16 ounces of water is going to give you your best shot at this working. Keep in mind it's a supplement, so not everybody responds to this, but I can tell you an overwhelming majority of our patients and customers are very happy with the results.
Perfect. Alrighty. Next question here. If you're over 70 and have had 75% of your prostate removed via aqua ablation, can I get more than a few drops when having an orgasm?
Yes, possibly. Anytime we're doing a procedure on the prostate, you can affect its normal function. We talked a little bit briefly about those ejaculatory ducts. So assuming that nothing was injured in the procedure that you had, you're still producing that fluid. It just got to kind of get its way out. If you noticed a big change in your volume post-procedure, you could also be experiencing retrograde ejaculation. That is something that is associated with certain procedures that we do on the prostate. So if it's something that's bothering you, I would maybe have a conversation with your urologist to see if you're having retrograde ejaculation. If you are, there's unfortunately not a lot that you can do about that once that happens after surgery, but you could try taking something like Popstar, which will increase the total fluid being produced, and that could lead to a more significant increase in volume.
Perfect. Alrighty. Next question here. Can pelvic floor exercises help improve ejaculation strength and/or semen volume?
Yes. Yeah. So, I mean, they have a direct impact on the contractions. which has a direct impact on force. Now, if you are producing low volume, pelvic floor contract or pelvic floor exercises won't necessarily increase volume unless you're starting out from a place of weakness, right? And you strengthen those muscles, and the fluid wasn't able to get out as easily before. Now you're generating a better contraction. You may see an increase in volume, but most people, when they do pelvic floor exercises, they notice an increase in volume and force, like it shoots farther.
Quick question here about the 30-day supply of Popstar. Someone's asking about the price. I believe
Mhm.
off the top that is, I want to say it's around $50.
Yeah, it's about $50 for a 30-day supply. I don't know if we got to the slide at the end, but there is a discount that we are offering if purchased through MenMD.
Yeah, that is the wonderful gift coming up.
Sorry to
So
spoil the surprise.
no worries. That'll keep some people waiting here for us, won't it?
Yeah.
All right. Next question here. What could watery semen indicate about your health?
So watery semen, if it's a change, right? If you used to have more sort of like a thicker ejaculate and it suddenly becomes watery, that could indicate some sort of infection or inflammation of the prostate. Really, any change in consistency, if it's consistently different, then it can sometimes indicate inflammation or infection. It doesn't necessarily portend bad health, but it may be worth evaluating to make sure that your semen's good, that your sperm parameters are good, and that you're not having any sort of infection or inflammation.
Certainly. Alrighty, next question here. Can certain medications reduce semen production or quality?
Yes, some of them I think we talked about. So, any medication that affecting the pressure dynamics in the urethra, things like alpha blockers, medications like Flomax, that men get put on to help them pee better, can cause retrograde ejaculation. Medicines that shrink the prostate, so there's a medicine called finasteride that some men with enlarged prostates get put on, can dramatically reduce the amount of fluid that is produced by the prostate. So there's definitely medications that can affect it. Um, so if it's something that you're experiencing, I would encourage you to discuss that with your provider to see if it's a known side effect.
Definitely. Alrighty, this one here is pretty interesting, but can bicycle riding reduce semen production due to the pressure on my groin?
I am not aware of cycling causing a decrease in volume, but I do see a lot of cyclists experience prostatitis or pelvic floor dysfunction, both of which can change the amount of fluid that comes out and the force of ejaculation. So I don't think there's anything inherently wrong with cycling, and the pressure that's exerted on the perineum. But if you feel like it has changed the quality of your ejaculation, then you may want to explore these other things. Um, have a session with a pelvic floor physical therapist to assess those muscles, and maybe talk to your doctor about ruling out infection or inflammation of the prostate.
Definitely. Alrighty, got time for a few more questions and then we're going to wrap up. So, does frequent use of ED medications affect semen health?
No, no, we love ED medications.
Yeah, don't stray away from those. Alrighty, what do we have here? What role, I think we covered this already, but this could be a good review about the zinc. What role does zinc have in maintaining a healthy semen?
So it can increase volume. It's been shown to improve sperm count and improve morphology, right? So those are all important reproductive health parameters. It is also linked to healthier testosterone levels. So that's, pro male sexual function. So zinc is a very important ingredient or supplement when talking about men's sexual and reproductive health.
Certainly. Alrighty, last question here. If you have any others, please drop them in the chat or forever hold your peace. But does caffeine help or hurt semen health?
It's a good question. I mean, I drink plenty of caffeine, and I don't think it's affected my semen health so far. I don't know of any data that have specifically looked at semen health and caffeine, so I'm not aware of any link. I think in general, overconsumption of caffeine can sometimes cause problems with men's sexual health. If you're drinking a lot of coffee, the bitterness of coffee can sometimes affect the taste of your ejaculate. But in terms of overall semen health, I don't think that there's any, I'm unaware of any kind of link between strict caffeine consumption and semen health.
Well, that's good to hear because I'm sure a lot of people love their caffeine. Don't want to get rid of that.
So, I think one of the big takeaways from today is to understand that semen volume can vary for a number of reasons, a lot of which we touched on today, and that's normal. It naturally goes down with age. That doesn't mean there's not something that can be done about it, especially if you're struggling to, say, get pregnant, or if you've noticed a decline in your sexual pleasure or a decrease in the intensity of your orgasm. These are things that there are things that we can do to help improve that. We talked about ways to do that from a lifestyle standpoint, from a medication standpoint, and certainly supplements like Popstar can help. So the bottom line is, if you notice a change in your ejaculate volume, in the intensity of your orgasms, in your sexual pleasure, talk to someone about it. And, if you want to try an easy kind of natural solution, Popstar is certainly there to support things.
If you'd like to learn more about semen health or Popstar, you do have a few options. We'd recommend that you visit the Semen Health Condition page on menmd.com, accessible from our drop-down conditions menu. You can learn more about what plays a role in your semen's health and how it can be improved, and there's also direct links to the Popstar products there as well. There'll be more resources in the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more, in case you want to learn about something maybe off topic. And if you're interested in any of the Popstar products mentioned tonight, you can learn more and purchase these accessories on the Semen Health Condition page or on the shop page on menmd.com.
A big thank you to Dr. Joshua Gonzalez for joining us today and breaking down the facts about semen health and male fertility. These conversations are what For the Good of Man podcast is all about. Empowering men with knowledge and resources to make informed decisions about their health. If you found this episode helpful, be sure to subscribe, leave a review, and share it with someone who might benefit. For more expert-backed insights and upcoming events, please visit menmd.com or follow @menmd on social media. We'll be back soon with another episode, but until then, take care, stay informed, and remember, open dialogue is the foundation of better health.